Hello everyone, my name is Bryson Pritchard with Pritchard Innovations, and I've worked in an intensive care unit for about 3 years now, and one day in the ICU still sticks with me. A patient went into cardiac arrest and I was one of the first to respond, and during that emergent situation, I remember looking down on the ground and seeing it littered with half-used syringes full of normal saline, and then as I looked to my left, I saw a nurse struggling to attach one last syringe onto the patient. So that problem arises with the current method of medication administration, which is you would take one syringe, attach a needle, draw up the medication, which is represented in red, detach the needle, and then attach it onto your IV. You'd administer the medication, but as you can see, there's a stagnant portion of medication still within the line that hasn't accessed your vein. So you would take a separate syringe full of normal saline to flush that stagnant medication to give you the full dose into your vein. So as you can see here, 2 foreign bodies access your bloodstream, which poses a huge threat to healthcare today, which is bloodstream infections. And per bloodstream infection, it will cost the hospital $45,000 to treat, and Medicare, Medicaid, other large healthcare insurers will not reimburse the hospitals for this cost because it's a preventable illness. But more troubling, out of every 1,000 cases diagnosed, 33 will be fatal and people will lose their lives over this. So my solution is the dyad syringe. It's a 2-compartment syringe. The rear compartment is pre-filled full of saline, and then the initial compartment is packaged empty, so it allows the end user, being the nurse, the doctor, to draw up different dosages, different types of medication, and then have a puncturing device, which then allows you to administer the medication, punctures into the secondary compartment, and then flushing of that line all in one syringe. So this is the heart behind my patent. This is the puncturing device that allows you to get into that secondary chamber. And then here's a functioning prototype of mine. So the medication is going to be represented in green. And then it punctures into that secondary compartment, and then complete flushing of the line in one syringe. So let's talk about the market. In my intensive care unit alone, we did 4,776 boxes of 30 syringes each, which put us at last year 143,000. So if you multiply that by 5, which is the amount of intensive care units we have within my hospital, it puts us at 716,000 syringes. Now you might be asking, how large is Halifax compared to hospitals nationwide? So we're about average, and that's out of 6,210 hospitals. So if you take that figure and you multiply it by the amount of syringes we did last year, it puts us at 4.4 billion syringes. So we buy these syringes for 30 cents each, but keep in mind, that's only saline syringes. That doesn't take into consideration the other syringes to draw up the medication, which we buy from 45 to 65 cents each. So I've done an extensive market validation. This is Margaret Tildy. She's one of the intensive care unit nurses that I work with. And she's actually a trainer, so she trains all the new nurses coming onto the unit. And during that time, she expressed to me the struggle that nurses have, especially in chaotic or emergent situations, to attach multiple syringes onto a patient for the same medication. So she sees the dyad syringe as a great application for that. And then this is Dr. Jan Voda. He's a critical care ICU doctor who specializes in neurology. And he actually gets contracted around the country to practice medicine. And every single facility that he's in, he sees the problem of bloodstream infections associated with catheters. And then this is Tanya D. She's a rapid response cardiac arrest nurse that I work with as well. And the medication that she's speaking about in this quote is called adenosine. So it's a medication that is a cardiac diagnostic medication, and it will stop your heart out of a lethal rhythm and restart it. The interesting thing about this medication is it needs to be administered as fast as possible, the entire dose, for it to be most effective. So our milestones achieved is we've done market validation. We completed our first working prototype, as you saw, in October 2018. In March 2019, we filed for a provisional patent status. In July, we filed for a utility patent. And from August till now, we've engaged in licensing discussions with 2 types of firms, one being the manufacturing side of firms, the second being the product development engineering side of firms, all within different timelines down the pipeline of progress with these conversations. And all those conversations revolve around this, which is my utility patent on the syringe. And our plan forward is to identify ideal licensing partners, assist partners to bring the product to market and sell. And our current cost estimation based on the conversations we've had with manufacturers is 30 cents each syringe. This is a huge plus because right now saline syringes are 30 cents for us to buy, so their manufacturing costs are lower. But the traditional cost to administer one medication in the ICU with those 2 syringes is around $1. So with our capabilities of manufacturing our one syringe that does both jobs for 30 cents and then sell it below that dollar figure, it gives us a great profit margin and also saves the hospitals money on every single medication they give to a patient. And then this is my advisory board. So I have Dr. William Jackson and Lou Paris as the entrepreneurial side of things. They were my advisors. They've been here since the idea has been on a napkin. This is Dan Glunt. He's a venture capitalist that I work with, not in the financial role, but more in the negotiation with a lot of these firms that I've been speaking to. He sold a lot of companies, so he's had a lot of experience in that. Tim Hopper and Jim Carnell are both in companies that are in the industry actively, so they're a great resource to speak about the capabilities of different firms that I'm speaking to. And Christy Myers is a nurse anesthetist. And so what's interesting about Christy is she also developed a product to cut down on infections in a hospital. So it was interesting to speak to her about working in the field as well as identifying the problems that exist. So thank you so much. Help me improve patient outcomes.
Thank you. 10 minutes Q&A begins now.
Congratulations, you have amazing advisors. I want to hear the story of how you convinced them to join you.
Oh, thank you so much. So I came into Stetson, my university, as a molecular biology major. So no knowledge with business at all. And how this came about was really just a problem I saw at work. So I showed up at their doorstep one day at the feet of the entrepreneurship program, said, hey, I have this idea. It's going to help people. And that's really how the ball started rolling, and everything is just history from then. So the premise around the entire idea is just to help save lives. 8,250 people a year die from this illness, and it's completely preventable. 250,000 are diagnosed a year. So that's the entire kind of passion behind the project, and they saw the same vision as me, and that's kind of where we started.
Can you tell us a little bit about your background? Are you currently in medical school? Is that the?
No, I'm pre-med. I'm undergrad, so I'm a junior at Stetson University down in Florida in DeLand. It's a super small liberal arts college, and so that's kind of my background.
And how'd you get into this? Like what drove you to start developing syringes?
That's a great question. So I had a love for medicine ever since I was 14. I asked my parents for a first aid kit for my birthday. So that's kind of where it came from. I started volunteer when I was 16. I used to work in the NICU, cuddling babies actually. And so right when I was 18, I built my connections within the hospital and started in the surgical trauma intensive care unit. So I work at a level 2 trauma center facility. And so we're super busy with traumas around the surrounding area. And then I transferred to the medical intensive care unit. So that's a little bit about my background and my job role within the hospital.
So are you going to continue to med school, or are you pivoting to be an entrepreneur?
Yeah, so I have a ton of ideas down the pipeline. When I walk through the hospital, I have a pretty good sense of what needs to be fixed. And I'm really grateful to be able to see that. And so this is one product of many that I have that I want to bring to market to help change the way that we conduct medicine today. But my ultimate goal is to go to med school and continue on with this.
Could you share with us, during your entrepreneurial journey, what are your main failures and how you deal with them, how you went through them?
That's a great question. So recently, I just had a company out of Texas. They're the largest private equity firm that manufactures syringes. And so we had a great conversation going. It was a licensing agreement that was on the table, very promising, but little to the knowledge of the people that I was speaking to, they were getting acquired by another private equity fund. So they weren't allowed to invest, so to speak, in another product and bring on another project, so to speak. So that was a large failure on kind of how I took it. Not had anything to do with the product or how it functioned. They went as far as hiring patent attorneys to do a defensibility. Everything looked great. They loved it. It was really just timing with their company and the future of their company. So that was a pretty big kind of pivot in the journey that I've had so far, because we got so close to getting this to the market and started changing lives. But so now we're just continuing conversations with a lot of other promising leads with firms.
What about in your personal life?
Our personal life, it's as any student entrepreneur knows, it's incredibly busy. Going to school full time, working full time, and then also learning an entire different trade. I had no idea anything about business, like I said earlier, and when I started Stetson, pre-med, no intention of going into business. So it's almost another full-time job in navigating this and figuring out kind of the best way to get this to the market.
So you have a very challenging, workload with pre-med school and going to med school, and then also your full-time job with the company. So what is the priority in your life? What would you say is what matters the most?
So that's a great question. Obviously, my education is a super large priority. I'm a firm believer with when I'm at work, the amount of questions you ask reveal knowledge, and the more knowledge you have, the more patterns you see, and then the more patterns you see, the more problems you see. And so work is a huge priority for me because I see how things can be changed. And that's really my entire premise around my entrepreneurship journey is really just solving those problems in healthcare and continuing on. So it's not just this one, but it's continuing on with multiple different products down the pipeline. So that's really my passion behind this, is just to help more people. You can help bedside, one-on-one, as much as you want, and you can do that for your entire career. But if you really change the way that we process medication and that we give medication and just healthcare as a whole, it starts to change more numbers than you can do in just yourself. So it's a lot bigger than me.
Congratulations, Bryson. One question I have is the technology that you created, is it something that you're selling that part to syringe companies, or are you going to manufacture the whole syringe with your part?
Mm-hmm. That's a great question. Yeah, so it's the entire syringe. And I want to make it clear, so I have one other competitor on the market, Credence Medical. They have a 2-compartment syringe. They're not FDA approved. The rear compartment is flipped, so that's how you drop the medication, but it limits you for microdosing medications. And then also the different varieties of medication as well. There's a couple prior arts that are on the market. One being this syringe, so it is a 2-compartment syringe, but the puncturing device of the secondary chamber is permanently attached to a needle, so it doesn't allow you to access IV lines. As well as this one, it's a permanently attached needle that doesn't allow you to access IV lines as well. And then there's 2 more with a valve. So if the line's occluded or there's something going on with the IV itself, it would actually mix the medications, which could become unstable. And so that's why I believe these are flawed engineering-wise. And so mine has that puncturing device. I believe you guys have a model there that allows you to do that puncturing device, but also have access to that line itself. So it's all one compartment. It's all one syringe with the pre-filled in the rear.
So you have FDA approval?
So FDA approval, it's a Class 1. I don't have it yet. It's a 510K submission. That's built into the negotiations I'm having with a lot of these firms because the majority of these firms, I'm not the first product that's come to their doorstep. So they have those capabilities of getting that F10K process or F10K approval process going and submitted to the FDA. So that's within their capabilities as a manufacturing firm as well. So.
And then Leslie, have you been testing this, and is there a certain failure rate on it? And if you do have a failure rate and you're in the ER, what happens?
Of course, yeah. So failure rates, they're very, very strict on that with medical devices. This is a Class 1, so it's designated as a low-risk medical device. It's not like a pacemaker or a knee implant. So on that realm, the FDA approval is pretty minimal compared to medications and such as that. But the failure rate is low on this as well. So it's a pretty foolproof design. I went through a lot of iterations of the engineering side of things to see what worked best in healthcare. And I've had a lot of people who are engineering. Oh yeah, of course, thank you. I've had a lot of people who have engineering backgrounds that show that this will work, and the failure rate is very minute.
So, have there been any moments on this where the business and entrepreneurial side just were really, really challenging that you were saying, you know what, I'm just going to go be a doctor. This is too hard.
Yeah, I think everyone in those who's in a journey of entrepreneurship knows those moments, right? Those highs and those lows. But what really motivates me and continue on, no matter how hard it gets, is really the fact that this will change lives. I mean, I met people, even at this competition, who have lost loved ones to this horrible, preventable illness. I met a real estate agent the other day who lost their brother to a bloodstream infection and required in the hospital. So right there is motivation to, no matter how hard it gets, to continue on, because I know that this is going to make a difference way larger than I can myself. So.
And can you share one of those challenging moments in particular?
Yeah, of course. Within my whole spectrum of entrepreneurship, or yeah, of course.
Getting this device to market.
Yeah. So there's only probably 15 to 20 firms that have the capabilities of manufacturing syringes in the U.S. today. So that's a whole difficult ballgame to kind of pinpoint those and also access them as well. It's been proven that it's been, I've overcome that challenge, but that's definitely a huge hurdle, not knowing kind of the background of them and the background of business to be able to speak the talk with them and get them excited about this product. But it's been proven a challenging aspect of my entrepreneurship journey, but nothing that I can't handle and overcome. So.
Sorry. The legal documents for this must be intense. How'd you do that, and how did you hire a lawyer?
No problem. Thank you, guys.